If you are engaged with any content anywhere that's telling you that you need to do it a certain way, I'm going to encourage you to run the other way, because that is only the type of rhetoric that is setting you up for feeling disappointed. And you need to find tools and resources and people that are going to champion you as an individual. And here's the truth. If birth was really depicted how it actually is, it's boring. It's boring because it's real and it's honest. When I hear the word plan, birth plan, I think that it's misleading, because that is assuming that you can control how birth unfolds. So I always tell people, we will talk about birth preferences. Again, going back to what choices and options are available to you. And we can put them together in a one-page with the least amount of words possible. Because I'll tell my client, the longer the birth plan, the less likely anyone will read it.
Welcome to the Golden Hour, the podcast community where moms and moms-to-be hear stories from other mothers and top experts in the pregnancy and postpartum care field. You can visit goldenhour.fm for more information, resources, and all other episodes. You can also find us at goldenhour.fm on Instagram for comments and questions. Welcome to today's episode of The Golden Hour. I'm your host, Dr. O, and today I'm joined by Keely Semler. I just realized I didn't get to ask you before we started how to say your last name. Did I do a good job?
Yeah, Semler.
Go girl. I'm so proud of myself. So Keely is a reproductive health educator, mentor, and doula with over a decade of experience supporting women and families through pregnancy, birth, and postpartum. She holds a master's in maternal and child health from USC's Keck School of Medicine and brings a powerful blend of public health expertise and compassionate care to her work. Keely is also the founder of Motherlands, a podcast and educational platform that explores the intersection between caregiving, reproductive health, and the systems that shape our experiences as women and mothers. Through her work, Keely empowers women to feel informed, embodied, and confident in their choices they make throughout their journey of motherhood. Welcome, Keely.
Thanks for having me. I'm so happy to be here.
I'm so happy to be here. As we were discussing in the pre-show, we are both doing this on the holiday, but it feels like it's even more, to me, more rewarding to be able to speak to someone who's as passionate about maternal health as I am, especially in these times where it feels like we need a lot of healing. So this is going to be a healing conversation for me, hopefully for you too, and whoever gets to listen. I'm just so grateful that the world has brought us together. I'm so grateful that our mutual connect, Taylor, did a wonderful intro, because this is the stuff that inspires me and keeps me going and makes me feel like the fight is worth fighting. So thank you for making time today.
Oh my gosh, my pleasure. And there's nowhere else I would rather spend this holiday than talking about women. So let's do it.
Yeah, let's do it. Let's be the voice for all today. I know that when I got to chat with you before we even scheduled this episode, a bit about your journey into this space, but can you tell us more about what brought you here and how you became the powerful birth educator that you are now?
Yeah. As you mentioned in the intro, I hold a master's in child and maternal health from Keck School of Medicine. And when I was in that program, I was studying how stress and trauma can impact health outcomes in women. And someone had asked me, well, what about childbirth? And I just sort of sat there and was like, well, what about it? And it
Yeah.
wasn't something that I had even considered thinking about. And that sort of led me down this path of learning about labor and birth and how someone's experience, how someone feels through their experience can really impact the health outcomes of the woman in labor as well as the child. At the same time, I had just accepted a job at a hospitalist group, this medical group at a very, very well-known hospital in my area in Los Angeles. And I was very excited to get this job straight out of grad school. Actually, I was still finishing my program, so I was still technically in grad school. And I was working for this medical group. I was sitting in these meetings with these doctors, and they're hospitalists. So they're doctors that work specifically for the hospital.
Mhm.
And I was listening to them talk about how to upcode a patient's
Mm.
diagnosis in order to get paid more, reimbursed more for the services.
Oh, shame.
And it just kind of I was realizing I'm not in I'm not on the side I wanna be on. This is not
Mm.
I don't belong here. And
Mm.
I think I lasted 90 days.
I'm impressed that you lasted that long.
It was really challenging. I mean, these were doctors driving just like $200,000 cars and showing up in these very lavish, outfits. And I just felt like this is everything that I don't want to be. If I want to help
Mm.
people, I want to be on the side of the patient.
Mhm.
I'm so excited to talk to you because you have such a unique perspective and a valid perspective. And
Mm.
I think often doulas get pit against doctors in a very unproductive way. And that's just not my approach. Every client I work with, their doctor is part of the team with us. And I
Yeah.
see myself as a small role in a bigger experience for my client. And whoever they choose for their provider, we're all on the same team here.
Mhm.
And so I don't know if that fully answers your question. It was sort of this long, windy journey of ending up in the birth world, which I knew
Yeah.
nothing about. And I felt for a long time because I was so young and don't have children of my own that I somehow didn't have a valid perspective.
Mm.
I slowly got over that, especially when I realized, wait a minute, there's male OBGYNs. They never experienced childbirth. So
Yeah.
if they could be delivering babies and know so much about women's bodies, I know a lot about women's bodies through my experience attending hundreds.
Yeah.
So, yeah.
Yeah. It's interesting how we all have that imposter syndrome, right? That I too have not had any children, but I've spent my entire career supporting women and birthers and their families. And I know that my experience and the way I support those families are so valid, and yet there's always that tiny little voice in our heads that tell us otherwise. And I still remember it was actually in my conversation with Taylor, our mutual friend, where she said, "Oh, yeah, but you've been mothering others and you're a mother yourself." And I was like, that was the first time someone turned that light on me for me to recognize I am my own version of a mother. There is still ways to be as ingrained in someone's experience, either in pregnancy and labor, postpartum, even if you yourself haven't gone through it. But it's so interesting how sometimes the most well-intentioned of us, I'm gonna put you in that same pool as I am, Keely, where we're just, like, naturally hard on ourselves in the way that we wanna show up fully to the people that we get the honor of caring for, and I'm glad that you in your own journey have been able to recognize the value of your thousands, hundreds, if not thousands of birthdays you supported and your own experience in your own body and how that then forms you. Speaking of experience, can you can you think of maybe a moment in your training or in your early days of being, a doula that really kind of wildly changed your perspective about birth, pregnancy, postpartum, something that you felt like was like a pivotal shift that was paramount for you?
Yes. Well, I also want to back up and say that I so appreciate your perspective about how you are mothering yourself and you are caring for others. And that's something I talk about a lot through my podcast and through working with clients is we are all mothering something, whether
Mhm.
it's a child or a job or whatever, family, pets, it doesn't matter. Like men mother something too. We all
Yeah.
as humans are mothering something. What that
Mhm.
something is entirely unique to who you are. So that's something I feel very strongly about. And
Mm.
not everyone gets to be a mother, and that's
Yeah.
okay. I don't know if I will be a mother, but I know
Yeah.
that I will continue to mother and practice the art of mothering, right?
Mm. Mm. That's so beautiful.
But to go back to your question, I can recall that my training felt like I had to go into hospitals guns blazing, like
Mm.
stand in between me and the patient and the doctor and, like just be sort of this like almost confrontational
Mm.
F the system kind of approach, which I didn't really resonate with and I sort of took with a grain of salt because I was coming from somewhat of a medical background and I was like, well,
Yeah.
this is kind of extreme. And then on the other end of the spectrum, I could see very early on how medicalized many healthy pregnancies became
Mhm.
and sort of this weird duality between this holistic, don't give away your power, this sort of spiritual lens of like, to be a superior woman, you need to do it a certain way, which
Mm.
I very much did not agree with or resonate with and struggle with currently to this day. And also turning every healthy person into this medicalized event. I think that
Mm.
there's so much in between there and everyone is so different. And I am not someone that is going to tell anyone that they need to do something a certain way. I am someone that provides education, resources, and helps people become aware of every single choice and option available to them, and also help them learn how to self advocate and ask questions to figure out what option they want to take, right?
Yeah. Yeah. No, I mean, you painted such a clear picture because I remember when I think about my exposure, my early exposure and experience with doulas during my training versus now, I have seen this shift where I remember, you know, when you're being as a trainee, you are being trained in a very medicalized system, right? You have to see certain pathologies, you have to make certain diagnoses, to do certain procedures, to build a skill set that is truly a privilege. Like I recognize every day that I get to show up for patients in a way that is an honor. And I'm grateful
Mm,
for the hours, many, many hours that was spent to get that skill set because to serve is the deepest privilege I've ever been able to give back. And yet, I remember in my training being, attendings telling me as you're about to go into a room, oh, and they have a doula. And immediately it paints this picture of like, okay, this is going to be an antagonistic relationship, right? Because instead of, as you described so lovely earlier on, instead of it being like this big team here to support one patient and the birthing experience and their families, it is us versus them kind of thing. And that energy, you don't want to bring that energy into any experience. But of course, if the duo is already assuming that the medical team coming into the room is going to be antagonistic, they're going to bring that energy too. And I remember earlier in my training career being told like, okay, well, that's a difficult doula, and that doula kind of gets in the way, and that doula is always saying the opposite. We're saying all this again, like he said, she said, us against them. Fast forward and whether it's just my own as I've gained more and more experience and more comfort in my own voice and advocating for my patients, I don't know if the shift I've seen has been a change in the healthcare system and our culture towards doulas, if the shift has been also changed within the doula community themselves. But I'd say now it's to the point where most of us, at least for me, I'm encouraging patients to have doulas because I also recognize that yes, in this very medicalized system that is faulty and flawed. I mean, one of the reasons why I've started this podcast is to recognize and say out loud as someone who works in a system, it's not perfect and we can do better. And let's talk about what we can do better. But in that system, it means that one provider, like if I'm on call, there's no way that I'm able to give the care and attention to each individual patient, let alone their families and support people. Even the midwife I'm working with, who's phenomenal. I mean, shout out to midwives, right? They are
Yeah.
experts in normal physiologic birth. And so, in that system that sometimes can feel overly medicalized, there's this beautiful angel that is a midwife that comes in and still speaks to the normal and helps support patients through that. Um, and then there are nurses who, again, they try to improve their ratio so they can have a lot of focus on their patients, but sometimes they can't. Sometimes our system is strained, and so I really advocate for doulas whenever, especially when I'm working with either first-time parents who just really they're kind of those unknowns of what to expect in labor and really kind of deserve that emotional, mental prep before birth, let alone in birth. And sometimes, honestly, and I think this is something, I will hopefully get a chance to dive in more about, are the patients who are coming with birth trauma from their prior birth experiences. It's time and time
Yeah.
again, there's something about that first birth that didn't go, quote unquote, according to plan, whether it was because it was out of their control or an unexpected event, whatever it might be. And those are the patients who oftentimes really do benefit for that additional voice of saying, okay, well, what are your intentions this time around? What are your preferences? How can we support that? And I really do think that like that us against them is the worst energy we can bring into any birth experience because it is going to be stressful. It's going to be a roller coaster ride and we never know what direction anything is turning. But if all of us are in that space, very much focused on holding space and creating space for the birther and the people that are nearest to them. I think that then we're doing them, by them I mean the patient and their families the service that they deserve. I think if we make that space about us and there is that like unspoken kind of tension between like doctor or midwife and doula, that's just like ugliness that I never want to bring into a space. And so I say all that all to say, I've seen this change again, whether or not it's from my perspective, and whether there's been a change within the healthcare system. But as a doula yourself, would you, how would you speak to maybe that change of like antagonism versus more collaboration now? Is it something that I'm just fortunate to see in my hospital system our hospital system is unique in that way? Is that something that you're seeing in the hospital systems that you have been in and out of in the LA area? What is your perspective?
I think it's layered.
Hmm.
I'm reflecting again on my training and how I learned that, you don't speak on behalf of the patient, you don't make
Hmm.
medical decisions on behalf of the patient, but there's almost some fear that is sort of instilled in doulas from the beginning, like you have no place communicating almost with the doctors
Mm.
or nurses, and that your job is solely on the birthing person and their family. And that's something I kind of threw out right away because it didn't resonate with
Yeah.
me. And when I go into a hospital, I really feel like it is a privilege that I get to be there because I can get kicked out. I don't work for the hospital. I'm really just a guest. And so, what I do is I usually introduce myself to the nurse. I want the nurse to know that I'm on their side and I'm not going to be combative or get in their way. And I usually walk in and I see like the stiffness almost like, oh, here we go,
Mm.
here we go. And I'm like,
Yeah.
hi, I'm Keely. Sometimes I wear a little badge that has my little MPH on it, and they're kind of like,
Yeah.
huh? Like,
Yeah.
what? And
Yeah.
then they start talking to me and they realize like,
Mm.
she's another resource for this patient, and I have 10 other patients I have to tend to,
Yeah.
and I maybe rely on her a little bit, and she won't let me miss anything, or, she can ask me questions if she has. So I feel like I can really only speak for myself, but I do
Yeah.
train new doulas as well. I actually train anyone that's interested in supporting birthing people,
Yeah.
even if it's a sister or an auntie or a mom, because it's not unique to me as a doula. Anyone can doula. And really, it's just being a loving, supportive neutral.
Mm.
presence. And I do think that some doctors have changed their mind about doulas, maybe not because their experience with doulas is always positive, but because of the medical research really saying that it
Yeah.
changes for the positive birth outcomes. So then there's like maybe a little of reluctance, like, okay, fine, doulas, But again, I don't fault them for it because I have heard and seen doulas do all sorts of things like being disruptive in the OR during a cesarean, and
Mm,
then that affects visitor policies. And then next thing
yeah.
you know, there's no doulas allowed in the OR because one doula ruined it for all of us. And it's like,
Yeah.
again, it goes back to being that loving, supportive, neutral presence. And I think
Mhm.
that that does have to do with how doulas are trained. And a lot of doulas take 1 or 2 day trainings, and there's no
Mm.
way that that actually is going to prepare you for all of the complexities and nuances involved in birth, whether you do it in the hospital or not.
Yeah.
So, yeah, I don't know if that answers your question, but I don't feel like nowadays, I work with the same providers in hospitals. Some providers I know so well, I have them on text and I can
Yeah.
call them at home and they refer me their patients and I refer them my clients because I know that my client is going to have a good experience in their
Yeah.
care. And they also don't feel threatened by me and they know that their patient is going to receive more guidance that's gonna make them feel calm and confident and safe in their body, and that is everything when it comes to having a positive birth experience. And to me, a positive birth experience is not just things going according to plan or what you want.
Mhm.
Having a
Yes.
positive experience is just feeling seen, heard,
Mm.
and held by your team. And if you don't feel that way, then it will absolutely impact how your experience unfolds. And that's huge for me.
Yeah.
That's actually the reason why I chose not to continue the path down becoming a midwife because during COVID, I was in midwifery school and I was doing this apprenticeship with a midwife and I was in my clinical hours and it dawned on me like my strong suit personally
Yeah.
is helping people feel more calm and confident and understanding their choices and options because that to me moves the needle with someone's experience.
Mm. Mm. So well said, Keely. There's so much that you said that resonates with me, and I think the one thing that speaks to me the most, as I already alluded to, is this concept of birth trauma and how so much of what we can say and not say and our body language and how we kind of may look at a nurse, whatever that I do when I'm in a birthing room or in an OR and anything that the nurse does, the anesthesiologist does, the OR tech does, any person who's in that hospital room or hospital space can make such an impact. And so hearing you say that the ideal way of supporting a positive or ideally positive birth experience is not so much promising that the birth preferences or the birth plan will always go exactly as one wishes, so much as making sure that that birther feels seen and heard. That's everything, right? And I think when I think about this big, complicated healthcare system that I've been trained to work in, and knowing that I really have these acute moments, right? Especially because I work in an amazing practice with collaborative care. And so our midwives are excellent in managing labor. And I'm oftentimes being called in when things get really hairy, right? Like I'm oftentimes being called in either because we're heading towards a C-section or operative delivery or there's a hemorrhage or something, right? I'm often being called into really these acute, more stressful moments. And I'm oftentimes training myself and challenge myself, okay, how can I show up in what's really scary for everyone in this room, but especially this patient, and make sure they feel that they can trust me, that I'm holding them in this space while also acting appropriately, kind of quick and focused on and carrying out the tasks at hand. What advice would you give me, the doctor that's talking to you right now, any kind of workers in the birth space listening to this episode? What advice would you give us to help us kind of hold more space for patients and make them feel seen throughout the labor experience, and especially, again, these, like, kind of acute stressful moments that can happen?
Well, first of all, I'm getting chills because I've never been asked that question. And I'm truly honored that you would even think, want to ask a doula, like what advice. Usually I feel like pretty irrelevant to most
Oh,
providers just because you guys have a really important job. I mean, I have an important job too, but different apples and oranges here.
yeah.
I think
Yeah.
that I think that what I would say is I know that you guys are busy and time is money and you got to churn out I don't know how many patients you see in a day when you do prenatal visits, but I know it's a short amount of time that you got to get through because
Mhm.
that's how it works, because insurance is not reimbursing you guys as much as they typically did. So now you have to work double hard to get what
Yep.
you're getting paid. And a lot of patients don't understand that. But don't worry, because I tell my patients that that's how it works and that it's not your fault. What I would say would be huge is really taking medical informed consent very seriously
Mm.
because I do not feel, I don't want to generalize here. So I don't want to generalize, but I don't feel that many, specifically obstetricians, take the time to really talk to their patients about medical informed consent, really lay out what the options really talk through why you think your patient needs to have whatever intervention you feel is
Mhm.
medically necessary. And this is a hairy one and I would love to hear your thoughts on this, but I know that medical informed consent, there's a lot of friction there with liability. And
Mm.
what I see is a lot of doctors sometimes preemptively sort of suggest certain interventions because they don't want to get sued. And I understand that.
Mm.
And I really do, but it's always at the expense of the birthing person. And
Mm.
I'm not saying that medical interventions are bad or wrong or never medically necessary. There are real reasons. And I educate
Yeah.
clients what are real reasons someone needs to get induced because induction is sort of vilified and there actually are real reasons that people need to be
Yeah.
induced. And instead of, you know, making patients or clients feel afraid of that, I kind of walk them through real reasons. But on the provider side, I just think that, like, it's so many times I've seen a doctor come in or a nurse come in after they talk to the doctor on the phone and say, we're going to start Pitocin now. You're not making the progress we want. And there's no like, is that okay with you? How do you feel about that? Do you want to talk to your birth team? Do you need some privacy to discuss this? How does that feel? It's just like, this is what we're doing now. And it's like,
Mm.
it's not because there's a medical emergency. It's because maybe that provider wants to get the show on the road. And it's like,
Yeah.
that kind of energy is really difficult. It's not impossible, but it's difficult. And I think that medical informed consent is not spoken enough or taken seriously enough, in my opinion, from the provider side. But I'm so curious
Yeah.
what your response
No, I this podcast, like I said, is to create space to talk about things, to talk about controversial things. And really, I always say this, medicine is so much not so much a science as it is an art, right? You alluded to the fact that it is really nuanced. There are times where I'm being called in the room because truly it is a true emergency. The baby's heartbeat is down in the 60s and we've got to go, right? And there are
is.
times where we're like, well, sometimes your baby's having dips. We're a little bit worried. We don't know where we're heading. We might head to C-section, but let's just talk about it in case we go there, not because that's what we want. We don't, at least for me, I really kind of practice anticipatory care. What that means when I'm in any medical setting, I honestly oftentimes put myself in my patient's shoes the best that I can. And for me, I think to myself, okay, if I'm being rushed suddenly to an operating room to have an emergency C-section and I have no idea what's happening, I don't know where my partner is, I don't know where my family is, like the doctor might be saying things to me really quickly about like, but this is a risk of like, this and that and that and that very, very quickly. That to me I think begets future trauma versus if I can be in a calm space and say, hey, I don't know why your baby's having dips. I really hope that we can figure out ways to make this kiddo happy. But just in case we have to do a C-section, whether it's an hour from now or 12 hours from now, I'm just gonna very calmly talk to you guys about what it entails. So you've just heard it, not because I want you to have it, but so you can hear it. And so what I find really validating by this conversation, Keely, is that I try my best, and hopefully this conversation will be an inspiration for other providers listening to kind of provide that anticipatory guidance, because I agree that informed consent is everything. My favorite way to practice care is what I called shared decision making, which means I give patients the information they
Mm.
need to feel empowered to make decisions best for them. I'm not, unless it's truly a life or death scenario, which that happens, I'm otherwise not the one who should be making like the final call. I really truly want patients and their support people to feel empowered to make the decision that's best for them, whether it's an induction, right? Like there's ACOG says that if you're over the age of 40, you should be induced by 39 weeks. But all of my patients, I say, hey, this is what ACOG says. This is why. Look at the data yourself. If you want to be induced, I'm going to do it. If you don't want to be induced, I'm not going to do it. And we'll just continue to monitor your baby. And if something happens, we'll act then, kind of thing, right? It really is about making sure that that relationship between clinician and patient, provider and client isn't one that is paternalistic or patronizing. Rather, no, I think the theme of our conversations is we're a collective team supporting this one person in the middle at the core, plus
Mhm.
they're at the outer core, which is their support people and their families. And so I think when providers and clinicians are able to flip that script in their mind, I think that's, at least for what I've taught myself in my years of training and now experience, is that's the best practice to me, is really kind of creating space to explain why we are doing what we're doing, or preemptively say, hey, if we're heading to the direction of C-section, helping patients understand why we might have to do it and what that would entail. But it's not easy, right? And I don't do my job perfectly every day, but when I'm in the right headspace, that's at least what I'm trying to do.
I was just gonna say, it's a really good day for me when someone has their baby in their arms and they reflect back to their birth experience, even if they had a cesarean. If they say to me that they felt really heard and seen and held, and that, I mean, of all the births you do, of all the deliveries you do, how many of those are real emergencies? Not many. I
Mhm.
mean, some.
Mhm.
And in those circumstances, like, yes, the patient needs to trust that you are going to do what you need to do. But
Mhm.
all of those other experiences, when it's just a failure to progress,
Mhm.
and, baby's not doing so great, we got to get him out, I always kind of prime my client, and they know because I'm there. I'm there looking at them. I'm there
Mhm.
watching things. I'm in the
Mhm.
room with them. I'm looking at them, and I'm looking at the screens, and I can say, there was another dip. Don't be
Yeah.
surprised. Someone comes in the room, or if we see 3 or 4 nurses and they have to reposition you to see if we can get baby's heart rate back up, so that they're not afraid. Because otherwise, just putting yourself in the shoes of the patient, like, it's very startling. It's very disruptive to just be laying in there doing your thing, and now you've got
Yeah.
this whole room full of people, and you don't know what's going on because not anyone is really communicating to you. They're talking to each other about
Yeah.
what needs to be done. It's just like, all right, let's bring this back to the human at the center.
Mhm.
The human
Mhm.
experience. This is a person that has emotions and that is feeling
Mm.
a lot of things. And I
Yes.
know that you see it every day, all day, but remember how incredibly special one time they do this.
Mhm.
One birth. And so for me, it's slowing down, it's looking at the person, it's making sure that when I communicate, I can communicate slowly and leave room for questions. And I can feel that with you too, even just how you communicate right now. Like, it's calm, it's clear, it's direct, there's no mystery, and there's also no superiority here. And I think that sometimes doctors come across to their patients like, I know it all. And if there's anything medicine has taught me, it's that we don't know anything. There's a
Yeah.
lot we don't know.
Yeah. Yeah. No, I say this, I mean, yeah, Keely, you and I are kindred spirits. So part of me listening to our conversation before, I'm like, I wish she was up in the Bay Area.
Oh my
I
God,
would
I
send
would
all my
totally
patients to
have you
you.
deliver my
We
patient,
would
my baby.
It would be such a jam, but no, I always say this to all of my patients. I have my at this point, like, my catchphrases, but I stand by them, and one of them is it is truly humbling to be another human who has the honor of caring for other humans, right? Because there's no
Mm,
complex here, right? That medicine is at best life-saving and has interventions that can really make a difference for patients and their babies, but it also isn't perfect, as you said, and so I think that any chance that we get as the birth workers in this magical space, any chance that we get to for introspection and reflection will only make us show up for our patients that much better. Something that you mentioned kind of through the work that you do is the importance of autonomy. What does it look like to help a patient? Again, as you probably can tell already, so much of this podcast is not only exploring topics that I think are important, but it's actually teaching for me. I asked you that question about, like, hey, how can providers be better? Because I walk away from all these episodes and I truly feel like I'm a better clinician because of it. So
mhm.
thinking about autonomy and how to support bodily autonomy, what does it look like? What is that conversation like with a client for you or patient with me to help them kind of walk into what can be a really scary space, right? Or a space where that locus of control is definitely tested. I think what I always have to reflect on is that even though I work in a hospital and I've trained in a hospital, so I've spent like my majority of my life in and out of hospital in a very different lens. For a lot of patients who are fortunately healthy, giving birth is the very first time they're gonna be in this, like, very kind of stark, sterile setting, and it can feel so jarring and so scary, and so I recognize that anything that those patients can do to really kind of feel grounded in that space and not overwhelmed by, some of the negative birth stories that they hear on social media and from friends and all these things that can feel so scary. I want to not combat because it has such a like a negative aggressive connotation, but I want to empower, I want to embolden, I want to bolster people. And so that's what I when I think about autonomy and bodily autonomy, it's someone in that space. So how do you approach that? How do you help a client feel empowered to walk into birthing spaces?
You just mentioned social media, and I in my first prenatal session, I tell all of my clients, "Get off social media. Get off social media and get off Google. They are not your friend. They are not going to make you feel calm, safe, and confident. You have to learn how to be so discerning about who
Mm,
you allow in, what information, what people, what energy." And I think that becoming a parent is a huge initiation into that because everyone has an opinion about what you do,
so
how you
many.
do it. And it's like, it's enough to make anyone feel like they're not good enough or that they need
Mm,
to be doing something better or different. It's just this hamster wheel of like,
mhm.
doing enough and why how can it be better and da da da. And it's just most of the time that is not building confidence, trust, safety, relaxation. So to me, autonomy has to do with really understanding the individual's body,
Mhm,
how they internalize uncomfortable sensations and situations.
mhm,
Because what I've noticed is that a lot of people are resistant to simply feeling discomfort.
mm,
And some of that has to do with trauma. Some of that
mhm.
has to do with our culture and how we pop a pill for any and all ailment. I'm not anti-medication, by the way.
Yeah,
There's a
yeah.
place for it. But I mean, I'm from the generation where it's like, "Oh, you have a headache? Go drink some water, take a nap." You know?
Yeah, exactly. My dad my dad's go-to was like I was like, "Dad, I think I have a fever." He's like, "Just gargle some salt water." I was like, "Okay, okay, I guess that will
Yeah.
cure everything, Dad. Thanks."
Well, also my mom, like, if we were, like, kids and we're like, "Oh, I don't feel good," she would kiss our forehead and she would go, "You're cool as a cucumber, you're going to school." You know? Like,
Yeah.
It's like,
Keep it moving.
yeah, and it's just like otherwise you could get so obsessive about like, the metrics and doing everything right. And I find that that can be a distraction from someone's ability to really tune inwards to figure out what they need to
Mhm.
feel calm and confident. So this question is very layered. I mean, it's really getting to
Mhm.
know the client, and everyone is different. For example, I have a client that knows she is going to be induced.
Mhm.
And when she hired me, she almost felt bad because she's like, I'm not trying for a natural birth. And I'm like,
Mm.
hang on a second. I am not judging you,
Yeah.
what you choose. And I'm so sorry that you have felt judged by your decision to give birth the way that feels right to you or makes the most sense to you.
Yeah.
And again, that's going back to this huge pendulum swinging from like this holistic, spiritual bypassy way of looking at birth to like this highly medicalized patriarchal, like it's like, whoa, let's figure out where you are on that spectrum.
Yes.
Those are two
Yeah.
very extreme things.
Yeah. So I'd like to take a moment to tell you this is my passion project based on years of experience as an OB/GYN doctor. I aim to empower moms and moms to be and those in the pregnancy and postpartum care space. If you appreciate what I do, please take a moment to like, subscribe, and share with your friends so we can reach more people like you. You can visit goldenhour.fm for more information, resources, and all other episodes. If you have any requests, suggestions, or questions for future episodes, please email me at hello@goldenhour.fm or leave us a comment at goldenhour.fm on Instagram. Keely, wow. Every time you speak, I have to like pause because it hits so deep. It's hit so hard. I think one thing that you mentioned that inspired one of the many inspirations for the podcast is social media. There were so many times in my years of practice where patients would come and tell me something that they saw on social media, and I always would joke, "Oh, my arch nemesis are like Dr. Google and Nurse TikTok." But the worst to me is the natural comparisons that people do. Like, well, so and so is posting on social media, they have like, a whole freezer full of like breast milk and I'm barely getting an ounce. Or so and so like looks like they're totally their bodies are back to normal after 3 months postpartum. Like, why do I still have this belly? Like all this
Mm,
comparison that feels so unfair. And so I think my tendency as someone who feels like, my purpose in life is to be a healer, is to want to hold and to tend to people and say like, no, 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 that's unfair. That's not true. And so my goal of the podcast is to be a voice of truth, a voice of empowerment, and to kind of break through that noise that is like negative and too competitive and just like a harsh mirror that isn't actually reflecting the trueness of pregnancy and birth and postpartum and the realness of motherhood.
that's right.
Yeah. And I also hear that pendulum swing, right? There's a reason why the midwifery movement was started by, I'm always blanking her last name. I think it's Ida.
Ina May
Trying to
Gaskin.
remember. Yes, thank you, Ida May. Because when, there were ways that we birthed before modern medicine, and unfortunately, before modern medicine, yes, there were maternal and neonatal deaths, and as we developed modern medicine, we were able to reduce mortality rates in a big way, which is beautiful. But then there was this swing where suddenly, women were given, I think they used to call it twilight sleep, where they weren't awake to meet their babies, or their only birth, they didn't push, like everyone was delivered via forcep, right? Not alone like even uglier things that were happening behind the scenes, like force course sterilization of people of color or people who were deemed unintelligent, like all these kind of nasty things that were done when people took the reproductive rights from women. Right, and then there was this swing, as you mentioned, because I think anything in life, and we're seeing the swing in our world right now, there
Mhm.
is that swings the other way of being like, "No, okay, I am woman, hear me roar," like, the only way I can have, like, the perfect birth is if it's unmedicated, if it's natural, if, like, nothing is done to me, and I just let it go, right? But then you end up with people who walk away from the birth feeling shame, feeling guilt, feeling like they can't celebrate themselves. But like, dude, one of the reasons why I love my job is every person, whether you birthed the baby or not, whether you had a scheduled C-section or unplanned one, whether you had a surrogate to carry your pregnancy, every person who enters that epic mode that is motherhood is a hero, is a warrior. And so for me, it's like, how do we deal with that pendulum swing that you alluded to, right? Where things are overly medicalized and honestly, be frank, not the way I'd ever practice obstetrics, to this now kind of sense of like, well, the only way to truly have birth is to do it like this one way. And then we end up ostracizing the many, 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 many people who are somewhere in the middle, whose birth stories are going to look like something that is true for them and not kind of prescribed way to be.
Well, both sides, right? Both
Yeah.
sides we're talking about strip away what it means to be a human.
Mm,
What does it mean to be a human with all of our flaws? It's like we're telling people, don't be human, be a computer, right? That's the medical side. The other side is,
mm,
don't be a human, be a god, you know?
mhm.
And
Be a goddess.
be a
Yes.
goddess. And it's like, if things don't go the way that you want them to, there's something wrong with you. And I think that there's something very damaging about that. And
Mm,
you don't get a trophy or, applause for doing it a certain way. You get your live baby. That's
yeah.
the prize. It's not you get
Yeah.
a trophy if you do it a certain way, or that you're somehow a superior woman if you do it a certain way. And anything, and I will say this to anyone listening, if you are engaged with any content anywhere that's telling you that you need to do it a certain way, I'm going to encourage you to run the other way, because that is
Yes.
only the type of rhetoric that is setting you up for feeling disappointed. And you need to
Mm,
find tools and resources and people that are going to champion you as an individual and support you, not someone else, a social media influencer that's getting paid however much money to peddle some breastfeeding product. Like, no. And that's why I tell people to stay off social media, because what you see is not real. And I can't even imagine the TikTok videos your patients bring you and say, like, is
yeah.
this real? Like, it's got to be
Yeah.
insane, because everything is clickbait. And here's the truth. Here's the truth. If birth was really depicted how it actually is, it's boring. It's boring because it's real and it's honest. And I
Yeah.
think that we live in a culture that sensationalizes drama. And
Mhm.
yes, of course, there are some what I call adventurous births,
Yeah.
but a lot of them are not. A lot of them are like pretty normal, pretty straightforward. And I don't think that a lot of pregnant people know that. And part of that is just with pop culture, how birth is depicted through, movies and TV and all of that, I think has left
Mhm.
an impression on us. Wouldn't you say?
Yeah. Oh, I 100% agree. I think when I think about that pendulum swing and I think about kind of combating the unrealistic notions on social media, I think that like conversations like this are part of the good fight, if you will. I also found myself kind of wondering about your perspective about birth plans.
Oh,
Right. I think for me as an OB, I often say like the best birth plan is your preferences because again, I will be honest, I am a type A person with a little dash of OCD. Like I love my check boxes. I love to get things done in a certain order. It makes me feel so good, so good. And so I recognize that if I ever choose to birth or have the honor of birthing, will probably bring that version of myself into that experience, and that's okay. I'm going to work on it ahead of time. But that's also how a lot of people are. I practice in the Bay Area, which means I have the honor of caring for many, high-powered professional women who, in the professional spaces, get shit done. But when it comes to birth, they have this checklist, and they expect that everything on that list will be done according to plan. And I have a feeling that you kind of help speak to that with your clients. What are the things that you tell clients when you're sitting down with them and helping them kind of organize their birth plan, the birth wishes, or birth preferences, however you term that magical sheet of paper? What's that approach?
This actually comes up when I'm interviewing to work with clients, and
Mhm.
I know very quickly if it's a
Mm.
good fit for me, if I'm a good fit for the person. And I'm not sure how your practice is structured, but I feel lucky in that I can choose who I want to take on as a client and
Yeah.
who I can politely pass on to somebody else. But
Yeah.
this comes up pretty much when they first meet me, and I'm very upfront about, again, going back to this element of needing to be in control. And when I hear the word plan, birth plan, I think that it's misleading because that is assuming that you can control how birth unfolds. So I always tell people, we will talk about birth preferences. Again, going back to what choices and options are available to you, and we can put them together in a one page with the least amount of words possible, because I'll tell my client, like, the longer the birth plan, the less likely anyone will read it. And in fact, I interviewed someone on my podcast last year, Enchem Ndefo. She's amazing. She used to be a nurse midwife, and now she has this incredible program on trauma called the Resilience Toolkit. She's incredible. You would love her.
Mm.
But
Yeah.
she used to attend births all the time because she was a midwife. And she would say, anytime a patient would come in with this long birth plan, the nurses would sit and laugh and say, she's going to go straight into a C section.
Aw.
And when she said that, I was like, damn, there is some truth to that. And part of that is just this need to control this,
Mhm.
maybe this, maybe neuroticism about like everything has to be just so because you're scared. But then
Yeah.
that's what we
That's where
need
it's
to
coming
talk
from.
about. Tell me why you're scared.
Mhm.
Let's allow the fear to have a nice, comfortable seat. Let's allow it to be here. Let's talk it through so that it doesn't have that intensity that can be
Mm.
disruptive during that experience, if that makes any sense.
Yeah. No, so beautifully said, and I think that energy, I really think of it as, like, this tightly wound energy, this is desire to, like, push away the fear. I think we oftentimes don't make space for negative emotions sometimes because
Mm.
it's scary to face it face to face, and so when you hold really tightly on that list of birth preferences or wishes, it kind of is a segue into how you early parenthood, right? Where you're like, "Well, but I know I'm gonna exclusively breastfeed for the first 6 months. That's the only way my baby's gonna get food, and so then I'm gonna triple feed if I have to." And then all of a sudden, you're just kind of you're lending yourself to this unfortunate domino effect that can lead to postpartum depression, anxiety, all these things that, again, I come from a space of love and nurturing, not necessarily paternalistic standpoint of being like, "Oh my goodness, what can we do to help the clients that you serve, the patients I serve to kind of start reframing that mindset because that all I mean, we haven't dived into like early parenthood and early motherhood like that. Ooh, that's even no offense to those of us who are in the birth space, but that's that's the most intense stuff. That's some real shit there,
Yeah.
right? And it
Well, it's
really carries
also
forward.
I think it has to do with feeling open and flexible and neutral
Mhm.
because, I mean, I have had clients, and I'm just gonna be honest, I have had clients who right off the bat are like, "I don't want a C-section. No matter what, I don't want a C-section." And I'm telling you, they're the ones that end up with a C-section.
Oh,
And it's just like,
you're right.
you gotta talk about it with like, "Why is that?" "Well, because you're
Mhm.
resisting. You're so
Mhm.
resistant to something that is out of your control, and there's just something about the universe."
I know, but seriously, we see it. I see it at work too. There really is something about like it's really funny that those patients who I care for, I'm like, oh, well, you just like I can tell. You feel the energy and walk in the room. Like I can just tell you just you're just giving to the will of what's meant to be. And there's like a calming in that room and there's an energy and they're just like, all right, like what's next? Let's go. And it's not because anyone's perfect, but you could just feel that energy. And it's energy that like, again, inspires me where I'm like the OCD type person in me is like, wow, like that patient taught me something today. Like
But
I
it's
can take some
also
of that energy too.
yeah, I think also to that point, that energy is trust. It's
Mm,
feeling calm and confident in their body. And that's not to
mhm.
be mistaken for blind trust or
Yeah.
uneducated. I'm just going to go and do it willy-nilly, whatever goes, whatever happens. No, no, I'm not saying
Yeah.
that. I'm
Yeah.
just saying have a lot of
Mm,
say and it might
mhm.
not line. And
Yeah.
how willing is that pregnant person, that mom to be, to loosen her grip a little bit. And by the way, I learn something every day from my clients because, like you, I'm a bit type A. And this is an experience that really requires letting go to a certain
Yeah, about things that are so important. But when I'm seeing clients like 10 minutes each, and it's jam-packed and there's so much I have to cover and I feel like I can't do it all. What are ways or what are questions that patients can ask their providers, their care team, in pregnancy, postpartum that can help them build that trust, right? Like that's something that is earned, that's something that is nurtured. It doesn't happen automatically. And so what are questions that a client can ask to help them kind of start garnering that relationship with their care team?
yeah, two come to mind. And if there's any providers listening, they're going to be like, man, I wish she didn't say that, but I'll
Go
say
for
it
it.
anyway. The first one is I always teach my clients to ask their provider, if I am healthy and my baby is healthy, how far past my due date are you
Mhm.
comfortable letting me go? Because you will learn a lot about your provider and what their intentions are around whether you get induced or how comfortable they are letting you go past your due date. And I think it's just good to ask that while you're still pregnant. Don't wait until you're 38 weeks to ask that. I mean, you can be
Yeah,
asking that. I would ask that like mid pregnancy. Once you get that anatomy scan and everything checks out healthy and normal, like that's a good time to ask. Because if
great.
you're someone that wants to have the least amount of medical interventions, you want to go into spontaneous labor, that that question right there will give you a lot to think about, you know?
Mhm.
The other question that comes to mind is I tell my clients to ask their doctor, have you ever had a patient who disagreed with your professional medical opinion and how did you handle it?
Mm, that's a
And
good one.
so I'm curious, have you had any sort of friction with a patient before and, where your medical opinion wasn't really in line with what your patient wanted and how did you handle that?
Yeah. Keely, I'm not on your podcast. It's my podcast, girl. No, just joking. No, it's a great question. As soon as you asked that question, I was like, oh, like what would be my answer? So I guess, yeah, I'm going to give you my answer. No, it comes up, it actually comes up a fair amount, which is why I believe in shared decision making. I think when you like take the privilege or take the oath to be a doctor, and for me, it's an oath I take very, very seriously. I think you also take on this concept of being a lifelong learner, which means if you asked me that question at the day one of my career versus now, I would have been giving you different answers. And what I've taught myself is like that's why the only thing I can stand by is shared decision making because there's oftentimes where I'm saying this is the recommendation, this is why this is my recommendation, and patients say thanks but no thanks, right? Or I can think about one of my patients who I think it's her fifth pregnancy. She had diabetes in one of her prior pregnancies and just refuses
Wow.
to do the diabetes screening test. And so I'm like, well, you know that the likelihood of you having diabetes in this pregnancy is really high. You're also an older version of yourself. So we know that the diabetes risk increases as we get older. But she's just adamant that she's just not going to do it. And so I just document that we had a conversation and she's informed. And I think when I let go of this I used to have this tension, if I'm honest with you, where it's just like, if something bad happens, it's all on me, it's all on me, it's all on me. And I'm like, get over yourself, actually. Like you said, it's all humans. We're all humans caring for humans, humans wanting to be cared for. That's all it really is. And so once I recognize, you know what, it's not on me. Like I can support and care for this patient the best that I can. And if they choose to do something otherwise, like I know I did my best and I don't necessarily have to have this energy of like frustration or like anger towards them. Instead, I'm just like, okay, like you made a decision. I don't agree with it, but that's fine. And so I think that that was a big flip for me because I remember having this energy of they must do what I'm saying because something like, the baby's gonna have
Hmm.
early diabetes or blood sugar control issues, or maybe they can have a shoulder dystocia because of undiagnosed diabetes, all these things that are possible. But if I tell them the possibilities and that client hears those possibilities and says, "Nope, I'm good. I'm gonna choose what I want," it really honestly creates more space and for me, like actually more relationship between the two of us because they can tell that I'm I'm really just giving them information and not enforcing it, if that makes sense.
Totally, it does. And then there's this level of accountability and responsibility on the patient that
Mhm.
they are making informed choices. And
Mhm.
if you make an informed choice, that, is part of your experience and that there's a level of responsibility there. And I'm, again, not saying people are responsible for their own trauma.
Yeah.
However, you get to decide most of the time who your provider is, unless, you're on Medi-Cal, which a lot of people are.
Yeah.
But, there's so many choices that you get to make along the way. And so every pregnant person has to realize like there is a level of responsibility there. Uh, and the
Mhm.
same on the provider side, like there's a level of accountability and responsibility there.
Yeah.
But it only goes so far, and I think that I'm curious what your thoughts are on this, but and I know this is your podcast, but
No, I'm just
just this idea of, like, I cannot rescue anyone. It is not my job
mhm.
to rescue anyone. I think sometimes
Yeah.
people hire a doula because they hear that they're good, they hear that there are better birth outcomes, but I don't give birth for you.
Yep.
And I certainly am not going to tell you what to do with your body or your baby. And I think sometimes certain clients or certain patients, they get the wrong idea. Like nothing bad can
Yeah.
happen if I hire this extra person. I am one person. I am not responsible for what happens. And neither ultimately, if a client is well or a patient is informed and it goes against medical advice, that's what an AMA is for,
Yeah.
then you aren't responsible either. And
Yeah.
that is a tricky one, and I really admire you, and I admire what you say. I think you're kind of in a tough spot half the time. Another reason why I didn't wanna be a provider, because I think it's so hard to have that kind of responsibility and to kinda weed through those scenarios, because I would imagine they
Mhm.
come up fairly frequently.
Oh, yeah. Oh, yeah, Keely. You get it. You get it, girl. No, it's and that's again why I often say, and I've said it already, like, that's why I'm humbled by what I do, and I think we all are trying our best, but conversations like this just make me think how I can do it better. It makes me think how I can, interact with doulas when I'm on call. Is it tomorrow or Sunday? I'm thinking about, when I am on call, how I can interact with doulas better. When I'm talking to my nursing team, how I can help them kind of understand how to create space for our patients better. There's because we're all just trying. We're all humans, just trying our best. As we wrap things up, I have a couple questions for you. When you think about all the beautiful experiences that you've had and the challenging ones, is there a moment that you've had either that resonates the most or something recently that really reminds you of your purpose in this space? A moment with like a client or a recent encounter that really just shines for you?
I really appreciate this question.
Yeah.
I don't know if there's like a singular moment
Yeah.
that feels reaffirming, but it's more of in the postpartum period when the whole family, like birthing person and partner, really look to me and go, "Holy shit, that was a trip, and we felt so held by you, and
Mm,
we thought we knew what we were doing, and we did not know, and you were right there," and that feels really good. That feels like, okay, there's some value there, and I'm happy to provide that because I feel that it's valuable, but it's always nice when that's affirmed to you with the people
mm,
you work with, and I feel lucky that all of my clients, most of them turn into friends, and I know that that's, like, not really a thing for, other professions, and a lot of doulas I think even my training, they're like, "Your clients are your clients, you move on," and I just was like, "No. If I am
good
going
for you.
up at 3 a.m. and drive my ass to the hospital and stay with you for 16 hours, and I'm there all day, all night by your side, and you appreciate me and I appreciate you, and I'm there in that tender moment. If you wanna be friends afterwards, yes, I would be honored to be friends."
Aw,
And
yeah.
some of them turn into, like I mean, I talk to clients whose babies are now, like, 8, 9 years old, and it's like,
They're not babies anymore.
I know, so it feels like I'm building a community of
Mm,
families that feel held and wanna share resources
mhm.
with other families, so I also connect clients together. "Oh, you guys live in the same neighborhood," or, "Oh, you have, you know, kids in the same elementary school," whatever, and
Yeah,
it's led me into this new chapter, which is I teach online. I have a whole educational platform that was modeled after my one-on-one work with my doula clients. And now this is accessible to anywhere because let's be real, working with a doula is expensive and
yeah,
not many people can afford it. And
yeah,
I want this to be accessible to anyone, anywhere, if they want the support, if they want the education and the tools and the resources. So it's really exciting. And I feel like,
yeah,
you know, yeah, I feel so enriched by supporting women and families through that important threshold. Um,
yeah. Well, yeah, look at you, Keely. I oftentimes one of the bigger things that I bring up is that one of the reasons why postpartum is so hard is because we lack that quintessential village that our ancestors all were in. But I see you as like this village creator, right? Like you are literally bringing families together, whether it's because of where they live or the schools that their kids attend to, and that's beautiful. That your desire to kind of go against the cuff and create continuity between yourself and your clients means that you also are paying it forward in a big way, let alone like creating a space for people to get access to doula support and training that isn't cost prohibitive. I had a patient who just transferred her care to me pretty late in her pregnancy, and we spent the whole visit just talking to her about her birth and again, the trauma around her birth, and she delivered in COVID, and she ended up with a C-section after a long induction, all this stuff, right? And she was like, "This time around, I want it to be different. That's why I'm transferring to you, Dr. Sarah. This is what my intentions are." And we talked about it. We talked through her expectations. And then she was talking to me about how much she really wanted a doula, but her insurance company didn't cover it. And so we talked about how our hospital has volunteer doulas, which is awesome. And I think all hospitals will hopefully at some point offer that, let alone insurance companies just need to change how they reimburse and what they pay for. But I love the fact that you're making that available because that is such a rich resource that as much as I recognize my privilege and be able to have this conversation with you. My personal privilege as being an OB/GYN doctor in the Bay Area, my goal is that any privilege that my patients can access because of their professional careers or their financial standing, that actually should be a right guaranteed to everyone. And so any movements, any actions that are overcoming health disparities are the things that I want to push forward the most. That being said, what is this platform that you have? What's it called? How can someone look that up?
yeah, I just also wanted to say too that you don't have to work with a doula to have a good birth experience. You do need education. You do
Mhm.
need tools and resources to help you feel calm and confident. Do not leave that up to chance. That's what I'll say. So, Motherlands is a podcast, but it is
Yes.
also an educational platform. So, we are motherlands.com, and I have a 12-week full access self-guided video lessons where I sit there and talk to the camera just like I do to all of my clients, and I go through this curriculum. We talk about what are the physiological changes happening in pregnancy, the
Mm.
emotional sort of grounded practices to feel in your body, to recognize when your body is communicating that something doesn't feel right. We talk
Mhm.
about how to get your partner to feel like an integral, very important part of your experience if you have one.
Yeah.
Talk about questions to ask your provider. We talk about how to find a good pediatrician. There's just so
Yeah.
many things. So, yeah, if I'd be happy to share it with you, and, if you have any patients that are needing that education and support from a doula that has attended many, many, many births, but might not wanna work with a doula or
Mhm.
have the means to, access a doula, I'd be happy to share that with you.
Yeah. Oh, I love that. No, we definitely, when this episode launches, all those websites will be in the description. And my favorite question I like to ask as I wrap up an episode is, we've spent the past, my goodness, over an hour talking about what it means to create space for others, what it means to be humbly human, if you will, and to make sure that birthing spaces are healing rather than combative and paternalistic. We also talked about how when this podcast airs, it's going to be promoted via social media, which is a-okay. But we also talked about how social media can definitely kind of add its own negative lens and sense of anxiety for women or birthers preparing for this epic journey. What would you say are kind of some final sage words of advice or wisdom that you would like to share to any moms or moms to be who are just feeling really anxious and maybe in their own mind unprepared for what lays ahead of them?
We live in a system that makes it very difficult to be in a woman's body. But that doesn't mean we have to feel bad in our bodies. We just have to be a little bit more mindful about what is needed to move through our lives and to find joy and meaning and love and support. And these systems don't need to break us. You just need to learn how to hold it in a way that serves you. And that
Yeah.
means speaking up. That means taking up space. That means having boundaries. That means saying no if something doesn't feel right. That means asking questions. And I think many women, myself included, were trained and conditioned and learned from a young age to be good girls and to do everything
Mhm.
right. And I would just say that if you resonate with what I'm saying, that you figure out what you need to feel good in your body and to take up that space and to be selfish, because at the end of the day, you give birth once. You never have to see these people again if you don't want to. The other thing is, for better or worse, you are a paying customer. So you deserve to be treated with respect and integrity.
Amen.
So that means that if you are not happy with how you're being treated, that you have the voice to say, I want a second opinion. I want somebody else. We're not gelling. You're not hearing me. I need to talk to somebody else. And yeah, to trust that you know what's right for you. And if you're
Mm.
listening to too much noise, it's really hard to hear yourself. So learn how to tune out the noise.
Mm, mm. So well said, Keely. As always, fellow podcaster, I literally can talk to you for hours, but we were
Yeah.
recording this, as we said earlier, on a holiday. It's a beautiful Friday, if you will. But it's truly an honor. I think one of the more unexpected treasures of starting this podcast, for me at least, is just connecting with people who are just as passionate about advocating for birthers and their families as I am, and learning from those people so that I can bring this back to my patients and my community. So thank you for being so generous with your time. I feel restored in a way that I needed to. I feel energized in a way that I knew I would be. And so I'm just grateful for this hopefully budding friendship and collaboration for the years to come.
Thank you so much. And I'm beyond delighted to have met you. And I am so grateful for who you are and your voice, and what you do is not easy. And I can tell that you provide such deep care to your patients. I'm just so grateful that you're there for your patients. And yeah, I am so excited, hopefully, to meet you someday in person.
Yes, yes. I have some of my best friends live down in the LA area. My mom lives east of LA, so I have many reasons to be down in SoCal. So yes,
Oh,
hoping to meet you in person. But in the meantime, I feel like we're sending energy waves to each other regardless.
yes.
And so again, thank you so much for your time, and so grateful for this episode.
Thank you.
Thank you very much for listening to The Golden Hour, the podcast community where moms and moms-to-be can hear stories from other mothers and learn from top experts in pregnancy and postpartum care. If you enjoyed this episode, please take a moment to like, subscribe, and share with your friends so we can reach more people like you. You can visit goldenhour.fm for more information, resources, and all other episodes. If you have any requests, questions, or suggestions for future episodes, please email me at hello@goldenhour.fm or leave us a comment at goldenhour.fm on Instagram. Looking forward to seeing you in the next episode. Until then, stay golden.